I'm now going to read a question from Simon Ateba, because he has been waiting, I think, 3 times to ask this question. I cannot see him in the queue, so I'll read it out for you, Simon. Simon, I hope if you're there on Twitter, you can hear this question. So this is from Simon Ateba from Today News Africa. Simon asks Dr. Tedros, the coronavirus pandemic is fast spreading across Africa and is threatening to overwhelm our weak healthcare system. The Center for Global Development in Washington, D.C. is warning that if developed countries do not support Africa today, this pandemic will not be defeated. What type of concrete assistance can WHO drive to assist Africa now before it's too late?
I can begin, and I'm sure Dr. Tedros will supplement. WHO has country offices in every country in Africa, and our country representatives and the teams there have been supporting countries for many, many years. In addition to that, our regional director, Dr. Moeti, has surged many, many staff from the regional office and teams to support countries and allow better support to be provided in planning. We've supported the process of national action planning, sent PPE, sent and dispatched lab tests. We've worked with the Africa CDC to train lab technicians from all over Africa, and we're currently working on increasing all of the capacities in surveillance, in clinical management, and trying to work to provide more support in terms of supply chains. It's a challenging situation for all countries in Africa, and the international community, I think, and for all countries of the South and low and middle income countries, need support. And the North must, while dealing with a massive crisis in its own regard, must move to protect the South, because nobody is safe until we are all safe.
Yeah. Thank you so much. Thank you, Mike. The number of cases in sub-Saharan Africa is around 1,600 as we speak. And if you take the number of cases, this is actually an opportunity to use the 6 recommendations I just made, meaning to be able to cut it from the bud. They can test, they can isolate, quarantine cases while still the number of cases is low. So the first thing is they should believe that this thing is in their hands. They can do something to stop it as early as possible. But then, of course, we have global responsibility as humanity, and especially those countries like the G20. We will have the G20 summit tomorrow. They should be able to support countries all over the world, not only from sub-Saharan Africa, but all over the world who are low-income or middle-income countries, because it's only through solidarity that we can support those countries. From WHO side, we have started as early as possible to support countries by providing test kits, and we have provided already test kits to more than 120 countries, and a good number of them are from the African continent, and also PPE to 68 countries, and most of these countries are from Africa. And WHO will continue to support countries who need our support, and we're negotiating with many stakeholders to build up our especially logistics capacity to continue to supporting countries as we have been doing.
Thank you, Dr. Tedros.